You've lost a tooth, your dentist has told you the tooth has to come out, and now you're wondering what to do about it. You've come to the right place. I'm going to cover all the options that are available to us, and I'll give you some information that I believe it would be helpful to you. Stay tuned. Hi guys, welcome back to the channel. This is Dr. Ahmad Rasti Kirdar. I'm a board certified periodontist and implant surgeon. And in today's video, we're going to cover the replacement options for a tooth that needs to be extracted. So you're probably wondering, why would I even care about replacing the tooth? I'll just have it pulled, leave it as is, right? That's an option. I do not recommend that at all, because what happens is the opposing tooth, especially if you've lost the bottom tooth, so the opposing tooth being the top tooth, is going to start shifting down into that space because of gravity. The adjacent teeth might even start tilting into that space. So that's going to really affect your function and your ability to chew. So that's an option to leave it as is, but not recommended. Now, option two, the best option that's out there, implants. Implants are basically screws that are placed into the jawbone. They fuse to the jawbone, and then you can get a tooth or a cap that sits on top. Most of the time, they're made of titanium. They could be made of other metals, but titanium is most widely used. Once the implant is placed, we wait a few months for that to heal, and then your dentist can put a cap or the crown that kind of screws into that implant. That's the best option. Option two, or actually option one, is not doing anything. Option two, implant. Option three, a bridge. Bridge is it's been out there for many years. And what happens is your dentist would need to put crowns on the adjacent teeth that are not affected, on the adjacent teeth to that area where you're missing that tooth, to be able to connect everything together. Now, as you can probably think, that would cause issues for the adjacent teeth, because anytime you touch a tooth, you start preparing it for a crown. It can cause issues such as the tooth needing a root canal. It can cause fracture and all sorts of other problems. And also, it's very hard to clean underneath a bridge because everything is connected to each other. So there's no gap for you to be able to floss. But it is an option. So that's an option. Now, the other option, which is the cheapest option, would be a partial denture, which is made of, it's an appliance made of acrylic and plastic teeth. Usually to replace a single tooth, it's not recommended because it's very inconvenient if you have multiple teeth missing. Maybe that would be a better option, but for a single tooth, really, it's not the best. And you would have to take it out at night and then put it back in the morning. And the chewing function with it is very minimal because, as you can imagine, it's a plastic appliance. So to kind of recap everything, one option is to leave it as is, not recommended. Another option is an implant, the best option. Another option is a bridge, and another one is to have a partial denture placed. Now, why do we even care about placing an implant? Again, as we mentioned, it's not good to leave it because of the shifting of the teeth. But one other point that I wanted to make is your jawbone is no different than any other bone in your body. What I mean by that is, with any bone in the body, if we don't put any pressure on it, it will start resorbing and getting thinner. Same thing with your jawbone. If there's no pressure on it, so whenever you're chewing or you're eating with your teeth, there are ligaments around these teeth that transfer that pressure of chewing to the bone and keep it healthy, and it remodels beautifully. Now, if that tooth is out, that ligament that kind of surrounds that tooth also is destroyed. And if we don't really kind of reintroduce that pressure to the jawbone, it's going to start thinning and resorbing and getting narrower. So that's why we see in a lot of patients who have had a tooth lost many years ago, we see very thin jawbone where we have to do augmentation procedures, bone graft procedures to be able to even place an implant. So that's why the sooner we replace that tooth, the easier it will be and the more predictable, because we're kind of reintroducing that pressure to the jawbone via the dental implant. So I hope this video helped you. You found some information that was useful to you. If you have any questions, please don't hesitate to contact me. And I hope to see you again in my next video. Take care. See you soon. Bye.